Good morning, everyone. My name is Sonoko from Tokyo, Japan, and I'm very honored to be here and appreciate the chairs and organizers to have me here. Uh, well, now my multidisciplinary team treats patients with severe peripheral disease and diabetic foot complications. In this study, we wanted to understand how nutritional status influences of limb amputation in critical limb ischemia patients. We have no conflicts of interest to declare for this study. I'd like to begin with a fundamental point. Age-related atherosclerosis is inevitable. Evidence of arterial plaque has been identified in ancient human mummies and in its 40s, actually, and in animals such as birds. So, as populations age worldwide, diseases related to atherosclerosis are becoming more common. Peripheral arterial disease is a condition in which various symptoms occur due to poor blood flow caused by narrowing or blockage of late arteries as a result of atherosclerosis. PAD is a rapidly growing global health problem. The prevalence increases significantly with aging society and affect both high income and low and middle income countries. So as a consequence, clinicians are encountering more often with the PAD patients with various arterial complications. So why PAD, the peripheral arterial disease, matters? Because severe PAD can lead to loss of mobility and impairment in quality of life. Patients experienced in the first place cold feet, then chronic pain, then causes difficulty in walking, and then less exercise and result in frailty and heart problem. So PAD causes the starts at a vicious cycle of the lower mobility. So the most serious complications in PAD is critical limb ischemia. Critical limb ischemia, or we call it CLI, represents the most advanced stage of PAD, and patients develop rest pain, ischemic ulcers, tissue loss such as gangrene, and the risk of major limb amputation. Major limb amputation usually defined as the amputation in below knee or higher level, has serious consequences. Studies have shown that approximately half of patients die within 2 or 3 years after the major limb amputation. This outcome is lower than colon cancer. So therefore, avoiding amputation is very important for elderly people, their quality of life and mortality. Treatment of critical limb ischemia usually requires multiple approaches. These include improvement of blood flow, restoring blood flow through bypass surgery or endovascular treatment like a catheter treatment, and surgically intensive wound care and internal medicine need infection control, glycemic optimization, antiplatelet agent, and in addition, we consider nutrition is one of the most important treatment of CLI, even though it is sometimes underestimated, overlooked. So why nutrition matters in CLI? Because wound healing is an energy-intensive biological process. The wound healing requires adequate protein reserve, functional immune system, and sufficient energy intake. Patients with critical limb ischemia often experience chronic inflammation, infection, and catabolic stress, and which can lead to malnutrition. And then malnutrition can delay wound healing and increases the risk of amputation. However, assessing nutritional status in these patients in early stage especially is not very easy. Clinicians often measure indicators such as BMI or albumin or weight loss or dietary intake, but each of these indicators has a limitation. For example, BMI does not necessarily reflect inflammation, and albumin can be affected by infection. The weight loss you can't estimate the actual weight loss. How many kilograms did you lose during these six months or something like that? It's very hard to ask the patient to recall this type of question. So then the focus on Canute score as a simple and comprehensive biomarker. So what is Canute score? Or maybe some dietitians or nutritionists already know this, which stands for controlling nutritional status, is a laboratory-based nutritional screening tool established by Ignacio de Ulibarri et al. In 2005. It combines three routine blood test parameters: serum albumin, lymphocyte count, and total cholesterol. Serum albumin reflects protein reserve, and lymphocyte count is an indicator of immune function, and because the proliferation of lymphocyte is very quick. So it decreases early in malnutrition. So it can act as an early warning sign of malnutrition. And the total cholesterol reflects catabolic and lipid reserve. So this is Canute scoring system. Canute score categorizes each parameter, those three parameters, into 4 levels: normal, mild, moderate, and severe. So for example, albumin greater than 3.5 scores 0, but under 2.5 scores 6. So those parameters sum up, finally you get this Canute score. So it means higher scores indicate worse nutritional status. So based on this background, the objective of our study was to evaluate which nutritional indicators best predict major lower limb amputation. We conducted retrospective cohort study including 293 critical limb ischemia patients. These patients were treated at our premise at a hospital between 2002 and 2017 with a mean follow-up period of 10.6 years. And we collected multiple clinical and nutritional variables, including BMI, BEE, hemoglobin, serum albumin, therapy, renal function, and Canute score. Our primary endpoint was amputation avoidance, how many people are avoided from the lower limb, the major amputation. This is patient characteristics. Mean age was 67 years old and 70 was male, and 61% was diabetic, and 27% was on hemodialysis. Diabetic, especially diabetes and hemodialysis, these conditions complicate wound healing and treatment outcomes. This is a result. Using a multidisciplinary treatment approach, we were able to avoid major amputation in approximately 80% of patients. The right side Kaplan-Meier, is outcome of each blood flow treatment, like a bypass operation and vascular treatment or so on. So now, next we performed a multivariate statistical analysis to identify predictors of amputation. The significant predictors included skin ulcer, hemodialysis, higher CRP, low albumin, and Knut score greater than 3.5. And then hemodialysis and Knut score over 3.5 were the independent risk factor of amputation. So this is how we finalized the Knut score cut of 3.5. And this is Kaplan-Meier is this is the Knut score. So you can see the higher score, their prognosis is worse. So the patients with higher Knut score had poorer amputation outcome. So these results can be interpreted in this way. When you see patients with Knut score greater than 3.5, they have higher risk of amputation. So therefore, early nutritional intervention may avoid lower limb amputation. We have learned that successful amputation avoidance requires collaboration among many specialists. So as I mentioned earlier, the blood flow, the restoring blood flow is a key to avoid amputation, but not only only the bypass surgery and the catheter treatment can avoid the amputation. The wound care teams as well, the physiotherapists, nurses, pharmacists, and nutrition support also plays an essential role within this multidisciplinary treatment program. Just I'd like to quickly show my patients. It's an 83 years old man untreated diabetes and severe infected gangrene. Initially, when he showed up at our hospital, below knee amputation was considered. But he insisted he didn't want to get amputated, so we took some multidisciplinary approach, and after finally his limb was successfully preserved. So what he had undergone was surgical debridement, arterial bypass surgery, and while those clinical courses, he had had a nutritional support throughout the clinical course. And then we completed the treatment with skin graft after maggot debridement therapy and negative pressure wound therapy, and so on. You can name it, and you can see the various specialists engaged in the patient's treatment. So this is my message. Malnutrition strongly predicts amputation in critical limb ischemia. And Knut score greater than 3.5 is a simple and objective nutrition screening. And early nutritional intervention may improve the amputation avoidance outcomes in those critical limb ischemia patients. Okay, this is my final slide. In conclusion, our study demonstrated that Knut score greater than 3.5 is a strong predictor of amputation in patients with critical limb ischemia. So integrating nutritional therapy into multidisciplinary CLI management may significantly reduce the risk of major amputation. And this is all for me. Thank you very much for your attention.